Hello, in this recording, I'm going to talk about healthcare delivery models around the world, and primarily as a way to show how the U.S. healthcare delivery system kind of fits in with others. So basically, I'll have an introduction, and then I'll talk about the five different models. So the United States has a fairly unique system of healthcare delivery as you look at others around the world. And when we think about healthcare delivery, we have to think about what really that means. And so it refers to what are the major components of the system. Who are the providers, who pays for it, and how are people seen, and things like that. So uh, it's also a process to enable people to receive that health care. How is that delivered to them? And the provision of it, the healthcare services to patients specifically. So there are five types in the world. Primarily, there's some kind of hybrids that you might find, but primarily there are five types. The beverage model, the Bismarck model, the national health insurance model, the private insurance system model, and then the out-of-pocket model. Now, sometimes you'll have people describe these in four, sometimes in six, a little bit different, but I think it's five is probably the best way to look at it because it covers most of the world. So let's look first at the beverage model. So most physicians in this model, and clinicians, of course, work for the government. So, the government owns the system. There are some private service providers. So there's really kind of a dual system going on. There's one that's a public system that everyone kind of pays into, and there's a private system. So for those using the public system, those people never see a bill because services are free and paid for through taxes. And so when you think of Great Britain or the UK, that's their system, as well as New Zealand and Spain. And Spain actually has been rated as one of the best healthcare systems in the world in terms of outcome. Okay, next we look at the Bismarck model. So the Bismarck model, as it might sound, was developed under Otto von Bismarck, and he unified Germany, as it might be, in the 19th century. And so he developed this system, right? And it uses insurance companies to pay for healthcare, as most do, but it's paid for by the employer and employee payroll deductions. Well, back up, right? Because that sounds familiar. It sounds like the US system, and it is similar to the US system, but in this particular model, everyone must be covered and no one goes without health insurance. So that's a big significant difference from the US model. And another big significant difference is that insurance companies in this model don't make a profit, where in the US, they're primarily for-profit organizations. And so we have countries, all very similar in terms of location. They're European, France, Germany, the Netherlands, and Belgium following this kind of Bismarck model. And then we have kind of an outlier geographically, which is Japan. Next, we're looking at the national health insurance model. And so what that model is has elements of both the Beveridge and Bismarck models. It uses private sector providers, which means that the physicians and clinicians, et cetera, are private sector, their own businesses, right? They're not run by the government. And they are paid from, however, a government-run insurance plan that everyone pays into. So you might be a physician owning your own business, and then, of course, the services that you provide to your patients paid through the government-run insurance plan. And since it's all one particular insurance plan, very different than what we have in the US, it's also known as the single payer system because there's one insurance company. And so Canada is a great example of this particular type of system, as well as South Korea and Taiwan. You also note that I'm really up on my flags of the world, right? Some of them are labeled, which makes it easy. I would know Canada anyway. But I digress. The next one is the private insurance system. So these providers tend to be independent business owners or employees of private enterprises. And that's what we have going on in the US, right? So we have insurance companies that are private companies, and we have physician practices that are run as independent private companies. So the practitioners are not employees of the government nor traditionally of big hospital systems. Now that is changing in the U.S., right, where more and more more and more employers, or I'm sorry, more and more physicians are becoming employees of large healthcare organizations. People are in this particular model insured through their employer and or self-pay, or they go without insurance. So basically, you could be paid through by your employer, which about 50% of Americans are. Um, or if you're like self-employed, then you pay for it yourself. Or if you don't have any of those options, then you can be uninsured. And of course, the US is a good example as private insurance model. And then lastly, we have the out-of-pocket model. And here there's no nationalized health care. There really is no system of insurers. People pay for the health care they need from their own resources. So if you needed to go to a physician, then you would pay the physician out of your own pocket. Hence the word, the out-of-pocket model. So many poorer countries, or even those, that aren't necessarily poor, but have really rural regions in those particular larger countries like China or India would fit this kind of model. So that concludes this recording where I talked about different types of health delivery models around the world.